Other things that come up in the postoperative course, I think relate to some patients inquiring about hyperbaric oxygen. Some patients inquire about their CBD oil. I can tell you that the studies have shown that an inflammatory response is a signaling that goes on when these new cells are trying to establish themselves. In other words, they're sending out signals that say, hey, we need some help from the surrounding cells. If we inhibit that inflammatory response, then those signals don't occur, and then the cell, I don't believe, is going to necessarily hook itself up and develop permanence. So avoiding something like CBD oil, certainly for the first several months, is also a good idea because it's a great anti-inflammatory, but we want a little bit of that inflammatory response and signaling. Hyperbaric oxygen, if you pound the body with high oxygen saturation, hypoxia, and the lack of oxygen is one of the signals those new cells are sending out to the surrounding cells saying, hey, we need some help. So if you pound that with oxygen, those signals never get there. So again, I don't think the cell gets to establish itself permanently. So these are the things, as I said, that I've also covered with patients when they have those questions. And certainly in the early postoperative period or the perioperative period, people are always asking, well, what can I do to maximize the result? I think a well-balanced diet, of course, is one thing. Following the other regimens that we've asked of you. We'll send you a perioperative regimen of vitamins, minerals, and trace elements that we know don't affect the blood clotting in our perioperative period and don't affect, from the standpoint of the inflammatory response. After that, as I said, if you've got any question about it, just hold off for a while. A lot of people supplement themselves for a good bit of the time prior to surgery. You have good reserves. You don't really have to worry about, burning all those reserves in a 3-month period of time. When you go back to your regimens, of course, it'll restore those reserves.